Anatomy and physiology, which is commonly abbreviated to A&P, form the bedrock of nursing knowledge, serving as the essential framework upon which safe, effective, and holistic care is built. Anatomy is the study of the body's structures, which focuses the organs, tissues, cells, and their spatial relationships to each other. Physiology, however, focuses on how these structures function, interact, and work together to sustain life. When combined, A and P provides a comprehensive understanding operates in both health and disease. For healthcare professionals, especially nurses, this understanding is not just beneficial, it's vital for recognizing when something is wrong, intervening appropriately, and promoting patient recovery. Nurses are uniquely positioned at the front line of patient care, often being the first to notice subtle changes in a patient's condition. These early observations, like a slight increase in breathing rate, unexpected swelling in the lower limbs, or reduced urine output, may seem minor at first, but they are often the earliest indicators of underlying physiological changes. In fact, with an understanding of A and P, you could understand how these three clinical observations could be pointing towards a problem with the patient's heart. Performing observations are grounded in a nurse's knowledge of A&P, but beyond observations, A&P knowledge supports clinical decision-making and prioritization. Take, for example, a patient presenting with chest pain. The nurse must draw upon their understanding of the cardiovascular and respiratory systems to assess potential causes. By monitoring blood pressure, heart rate, respiratory rate, and oxygen saturation, the nurse can identify warning signs of a myocardial infarction, heart attack, or other life-threatening events, ensuring rapid escalation to the appropriate medical team. Without a solid grasp of A&P, nurses would be far less equipped to recognize when a patient's condition is deteriorating or to advocate effectively for timely care. A&P also forms the foundation for clear and precise nursing communication, both within the healthcare team and with patients. Using anatomical language ensures that information is conveyed accurately and unambiguously. For example, describing a wound as inferior to the left patella gives a far more exact location than simply saying below the kneecap. This level of precision is critical for handover reports, documentation, care plans, and interdisciplinary communication, reducing the risk of errors, improving patient safety, and ensuring continuity of care. Moreover, understanding A&P enhances a nurse's ability to educate patients and families. Whether explaining why a patient needs to sit upright to ease breathing or how certain medications affect blood pressure, A&P allows nurses to translate complex medical concepts into accessible, meaningful explanations that empower patients to engage in their care. Hopefully, this has given some examples to demonstrate that A&P is not just theoretical knowledge, it is a practical, everyday tool that informs every aspect of nursing practice. From performing head-to-toe assessments and understanding the mechanism of action of medications, to interpreting diagnostic tests and recognizing early warning signs of clinical deterioration, A&P ensures that nurses deliver care that is safe, evidence-based, and centered on the patient's needs. By continuously applying this knowledge, nurses uphold the highest standards of clinical excellence and contribute meaningfully to improving health outcomes across diverse patient populations.